Hi all, welcome to Neet Pg series 1. In this video I am going to discuss about the topic necrosis, which is one of the most important topic for our Neet PG. What is necrosis? Necrosis is a pathological cell death and inflammation is present and microscopic examination shows pink amorphous and there is no ATP is used, so it is a passive process, and also cell will swells in the necrosis. Coming to the type of the necrosis, we have coagulative necrosis, liquefactive necrosis, gaseous necrosis, fat necrosis, and fibrinoid necrosis, and gangrene. Coming to the coagulative necrosis. In coagulative type of necrosis, architecture is preserved, but the sometimes the details may be lost. So in microscopy they will show ghost cells, and also they will show a tombstone appearance, which is a feature of the coagulative necrosis. And this is shown by solid organs like kidney, liver, and heart, more common in heart, and also Zenger's degeneration in typhoid. In there is the necrosis in the skeletal muscle, mainly rectus abdominis and diaphragmatic muscles. Coming to the second type, we have liquefactive necrosis. In liquefactive necrosis, the architecture is not preserved. Here the example is CNS and pancreas. Next is the gaseous necrosis. It includes both coagulative necrosis and liquefactive necrosis. But more is the coagulative, 80% of it is the coagulative necrosis. It shows a cheesy appearance. TB, syphilis, and fungal infections like histoplasmosis and coccidioids. Next is the fat necrosis. In fat necrosis, there is a chalky white precipitate. It is shown in the breast followed by trauma, and in omendum, in acute pancreatitis, they will release an enzyme called lipase. This will activate the omendum, and this will lead to the breakdown of the fat, which will lead to the deposition of the fat and calcium. So there is a chalky white deposit in the cells. Next is the fibrinoid necrosis. Fibrinoid necrosis, there is antigen antibody reaction. It is seen in polyarthritis nodosa, rheumatic heart disease, SLE, malignant hypertension. Next is the gangrene. There are two types of gangrene. Gangrene is the blackish discoloration of the organs due to the blood vessel occlusion. There are two types of gangrenes, dry gangrene and wet gangrene. Dry gangrene is coagulative type of necrosis, and wet gangrene show liquefactive type of necrosis. In dry gangrene there is just only blood vessel occlusion, but in wet gangrene there is also superadded infection along with blood vessel occlusion. So there is a line of demarcation is present in the dry gangrene, and there is no line of demarcation in the wet gangrene. So thank you. This is a video on necrosis. So thank you.